Hello everyone, I'm Wafa. I hope all of you are doing fine and well. So this video is going to be slightly different from the other videos that I've been doing in which I would give feedback. In this one, basically, I'll be explaining maternal medicine, the history taking part, how you're going to take history from the patient, okay? And this video is done upon a special request from one of the candidates who had a problem in how to finish in 3 minutes. So you all know that the 3-minute limit or recommended time for history taking in the exam, because you only have 10 minutes. It's quite easy, it's simple, as long as you know what you're going to ask, and most importantly, why you're going to ask these questions, how you're going to ask them, and in what order you're going to ask them. I'll be using cards that I prepared just to make things visual and verbal at the same time. So in maternal medicine, we have preconceptual counseling, and we have a woman who is pregnant and she came for her booking visit. She may or may not have had preconception counseling. Before we go on to the history taking, let's just briefly talk about what's the importance of preconception counseling. Generally, even if a woman doesn't have a medical condition, every woman is encouraged to have that preconception counseling visit with the obstetrician, just to see her health, if she has any habits like smoking, alcohol, recreational drugs, how she can optimize her health, stop these habits, and what would be the risks of all of them, okay? So that's generally, but it is really recommended, and it's not a must, but yes, it is a must actually, that every woman who has a medical condition to receive pre-pregnancy counseling. And why is that? Because there is the medical condition, isn't there? And medical conditions, most of them would have an impact on the pregnancy, either for the mother herself or for her baby. And in order to prevent or minimize these complications beforehand, before getting pregnant, they would have this visit with the obstetrician in which they would discuss what to expect and how to ensure that she has a safe pregnancy for her health and her baby's health as well. So basically, sorry, I just ran out of thoughts at the moment. So yes, I was talking about the importance of preconception care. Yes, I remembered that what is done. So basically in the history, you would want to see the woman's medical condition. How well controlled is it? Does she have any complications? What treatment is she on? Because you know that some treatments are teratogenic and they have to be stopped beforehand. If she has any social habits that she can stop in order to improve her health and her pregnancy outcome as well. Preconception counseling also allows any problems to be picked up and allows time for the obstetrician and the physician treating the woman with the medical condition to optimize her health, control her medical condition if it's not well controlled, review the medications, for example, and manage any complications before she gets pregnant. All of that, what's the aim of it? To ensure that the woman will have a healthy, smooth pregnancy with minimal complications in terms of morbidity and mortality, both maternal and neonatal. So having recapped and discussed all of this, that's really briefly done. Let's come and see and talk about preconception history and a woman who's pregnant with a medical condition, and she came in. How are you going to take history? So I have sorry, where are my papers? This lady, she is Katie, 27 years old, known, sorry, not this one, sorry for that, that was the second one. So Amy, again, 27 years old, known epileptic, sent by her GP because she wants to get pregnant. She's planning for pregnancy. Sometimes this is the only information that you would have. Sometimes they can give you, or at other times, some bits of information the GP can write it on the letter. For example, for how long she's been epileptic, is she on any medications before, did she get pregnant before? If you do have that information, of course, it would really cut down on the time you will take in history, because you will not be repeating those questions. I'll cover this. So in preconception, you have, in history taking, you have the medical condition on one side, all right? You want to inquire in detail about that. And then you have the rest of the history in terms of menstrual history, sexual history, parts of sexual history, then the rest of the medical, surgical, family, drug, and social history. All of that, you have to combine them, finish them in 3 minutes maximum, and it can really be done in 3 minutes. Okay, so let's agree this is our patient. She came in. What would I be doing? Okay, so to make this more easy and easier to follow and understand, especially for those who have no idea about maternal medicine, I'll just explain generally the aim of each element of the history, and then I'll be showing the flashcards. Well, they are flashcards made by me while I'm taking the history, just to show you that it can really be finished in 3 minutes. So you would want to inquire about the patient's medical condition. What do you want to know about it? Since when she had it? How well controlled is it? For example, we have epilepsy, so you'd want to know when was her last fit, the frequency of the fits. Is she following up with the doctor or not? What type of epilepsy does she have? Is it generalized or focal? And you also want to know when was her last follow-up visit, any complications in terms of any hospital admissions, any ICU admissions, any treatment she's taking, right? And that's it. You would then go on to the rest of the history. Why would you want to inquire about menstrual history? Because you want to see, are her periods regular? If her periods are not regular, then there can be a delay for her in getting pregnant, and you would want to sort that out. So you want to know about that. Most importantly, her last menstrual period, because you want to make sure that she's not pregnant at the moment, and of course her smear history as well. When you finish from menstrual history, then go on to sexual history. In sexual, you want to know if she's using any contraception, and that's it. I don't think that you need to ask about dyspareunia, problems with sexual intercourse, okay? Because this is not the aim of this scenario. It's just maternal medicine. So it's okay to skip a few questions. You would then want to go to her past of sexual history. Most of the women they're going to be mothers or get pregnant for the first time. That's why they came in for counseling. Others, they may have had children before. If yes, you would want to know if she had any problems in the pregnancy. Did she have the medical condition when she was pregnant the previous times? And the mode of delivery, very important, and the outcome in terms of baby. Why? Because in epilepsy, it has been shown that if a woman has a previous baby with a congenital abnormality, it can be due to the medication she's taking or any other cause, there's a higher chance for her than other previous women for her baby to have a congenital abnormality. That would really help you in counseling her. You then want to go to the medical history. Do you have any other medical conditions? Right? Very important, I stress on the word other, because you have already inquired about the epilepsy, so you do know that she has a medical condition. If you ask her, do you have any medical conditions? She'll tell you, yeah, I have epilepsy, that's why I came here, so avoid that question. But what I would advise is that for you to save time is when you inquire about the epilepsy and finish from it, ask her, generally in your health, do you have any other problems at all? If she has a medical condition, believe me, she would tell you in the exam. So that's a way in which you can omit this, all right, and take it away. I'll just put it back here. And then you want to go to surgical history. Do you have any operations in the past? Family history, just to see if there's any genetic problems that do run in the family, in which you would need to refer her to a genetic counselor preconceptionally. And then you want to go to drug history. Drug history, it's just like medical history, because at the beginning when you're inquiring about her epilepsy, you ask her for treatment, all right? Or you could have the treatment mentioned for you in the GP letter, so you then want to ask her, are you taking any medications? She'll tell you, yes, I just told you I took medications at the beginning for my epilepsy, so avoid that question and ask her, are you taking any other medications apart from the ones that you told me, right? Or you can do the same as medical history, omit that part, take it out. I'll put it back again here. And what you would want to say instead is that when you cover the epilepsy at the beginning, we agreed that you would ask at the end, any other health problems? No, that would cover medical history. Any other medications that you are taking? So medical history, drug history, both put up together with the medical condition that she has when you inquire about it at the beginning. You then want to ask about social history. Why? In terms of smoking, alcohol, recreational drugs, give her advice to stop these and explain to her why you would advise to stop. Give her NHS supporting services to stop what she has. Sorry, just let me take this notification out. And don't forget the health of her husband, because she will not be passing her genes to the baby on her own, wouldn't she? There's also the husband. So inquire, is your husband fit and healthy? Because if the husband has any genetic problems or problems that run in the family, then that would need a genetic counselor as well, won't it? And in social history, inquire about her support at home and her relationship as well, just to exclude domestic violence, okay? So this is how you would go through the history. You can see that if you understand the aim of each question, then you would really know how to ask the questions, all right? So let's go to our scenario. So Amy, okay, 27, non-epileptic, wants to get pregnant. So I'll be taking history. So I'll be playing the role of the doctor and the patient at the same time together, okay? So Amy, is it okay if I ask you a few questions? All right. Amy, can you tell me more about your epilepsy? Well, I had my epilepsy since I was a baby. I think I was born with it maybe. And my mother didn't tell me much about it. And it's a generalized type in which my body fits all throughout. I've been quite stable in the past few years. I didn't have any problems at all. All right, Amy, that's good to hear. So I'll just recap what you told me, that your epilepsy is the generalized type. You have had it since you were a child, and recently the past few years you're okay. So in terms of you telling me the last few years you're okay, can you tell me about how frequent you have your fits, and when was your last fit? Well, I used to have them every 3 to 4 months, but then my doctor changed the medication for me and increased the dose a little bit of the other one. And now I barely get them like every year or so. All right, that's very good to hear, Amy. Have you ever been admitted to the ICU because of your epilepsy? No, I haven't, all right. Are you taking any medication? Yes, I'm taking carbamazepine. The dose, so carbamazepine is controlling the epilepsy really well, isn't it? She'll tell you yes. So a bit more, sorry, I forgot the medical. So Amy, apart from epilepsy, any other health problems? No. Are you taking any other medication apart from the carbamazepine? No. Can you tell me about your periods? So there's an open-ended question, okay? Can you tell me about your periods? Well, my periods are regular. They come every month. They stay for around 5 days. So you don't have any problems at all? No, I don't. When was the last period, Amy? Well, it was 2 weeks ago. Okay, that's good. So are you with someone at the moment? All right, sexually active right now? Yes, I am, okay. Are you using any contraception? Yes, I am. I do have the copper loop inserted. All right, have you ever been pregnant before? No, I haven't. So this is omitted. Did you have any operations in the past? No. Anything that runs in the family? No, nothing that I'm aware about. That's out. Do you smoke, Amy? No, I don't. Do you drink alcohol? Well, sometimes at the weekends. Any recreational drugs? No. You told me you're married. How's your husband? Is he fit and well? Yes, he is. Any problems, health problems that run in his family that you know about, maybe? No, nothing. How's your relationship with him? Well, everything's fine. He's supportive? Yes, he's supportive. All right, Amy, thank you so much for sharing this information with me. I don't know how many minutes that I took, but this is how you go through the history. Okay, a woman who came for preconception counseling. Just let me put my papers back together. Sorry, so this is in. I don't know why I threw a few papers. Okay, just let me put them in the same order so we do not get mixed up. All right, you go here, you here, you here. And then you back at the end. Okay, and you here, this is the last one added to the gang. All right. This is our second patient, okay? Amy, 27 years old, known epileptic, she's 8 weeks pregnant. This time the patient came pregnant to us, okay? You don't know if she received pre-pregnancy counseling or not. So here you have 3. I wish I had a third hand, but you have 1, 2, and 3 issues. So the first is the epilepsy. Sorry, I'll change it. The first is the pregnancy itself, okay? And you want to inquire about that. Then you have the epilepsy, and then you have the rest of the history. So you'd be conducting a routine booking visit, if you know what I'm talking about in terms of booking history, but you'll add to it the question you want to inquire about in the epilepsy. So that's the added point in the history. So because she's pregnant, you want to know, is it a planned or an unplanned pregnancy? Did she receive any pre-pregnancy counseling or not? If the patient tells you is unplanned, when you come to sexual history, please don't forget to ask about, was she using any contraceptive? Because if she was not using a contraceptive, part of your job and part of patient safety is at the end of the consultation, tell her that after delivery, it's important to discuss with you contraception to avoid having another unplanned pregnancy, all right? So that's the only difference. Plus you want to inquire if she's taking any folic acid. So let's go on and see. So this is our patient. Sorry, she's not Amy, she's Katie. I mixed between the 2 names. So Katie, is it okay if I ask you a few questions? Yes, that's fine, doctor. Could you tell me about this pregnancy? Well, everything's fine. Is it planned? Well, no, doctor, it wasn't planned. I just found out by coincidence that I'm pregnant. All right, Katie, did you receive any pre-pregnancy counseling? No, I haven't. How's the pregnancy treating you so far? Everything's fine? Right, that's lovely to hear. Are you taking any folic acid? No, I'm not. A few questions about your epilepsy. And then you ask the questions, okay, after you finish from them, these questions that we know. You then go and ask her about her periods, and I'll tell you about her periods. If you do have a dating scan, you do not need to ask about her periods because you already know how far she's in the pregnancy. But if you don't have a dating scan, you want to see if the dates she's giving you and the dates written on the midwife's or the GP's letter, whoever referred her to you, are corresponding to her last period. So you ask her, when was your last period? Did you have any problems at all with your periods? No. So it's supposed to go out, and then you go to sexual history. Just ask her, are you with someone at the moment? Please don't ask, are you sexually active? I mean, how did you get pregnant? Okay, so sexually active is not there. Katie, are you with someone at the moment? Yes. Were you using any contraception prior to getting pregnant? Well, no, doctor, I wasn't. I stopped it on my own. Or she could tell you, I think I missed a few pills, or I was on the contraceptive pill. Right? Any pregnancies before? No. So this, we said you'll omit it. You'll ask it with the epilepsy. Any operations in the past? No. Anything that runs in the family? No. This would be with the epilepsy at the beginning, so we'll omit it. And then you go to social. Smoking, alcohol, recreational drugs? No, no, no. Who are you living with? I'm living with my husband. Is he supportive? Yes, he is. How about your husband? Is he fit and healthy? Any problems that run in his family that you're aware of, maybe? No. And in the past few weeks, have you ever been bothered by feeling down, depressed, or anxious? You know, these are the woolly questions and the anxiety questions. It's basic and a fixed rule for any woman who is pregnant. All right, and then you've finished. So you can see how easy and simple it is. It is really doable to finish it in 3 minutes, like I said, as long as you don't pause in between. And some people, why do they exceed the time I had? As I have observed with a few of my course candidates, is that on their own they lengthen the questions that they ask. For example, do you have any problems? Oh, sorry. When do they want to ask about periods? So periods is just, can you tell me about your periods? Okay, and then you fill in the gaps. So what I realize that some do, they ask it like this. So hear me carefully. Can you tell me about your periods? Can you tell me about your periods? Is your period regular? Do you have any problems? 3 questions together. You just lengthened the time, and the patient will be confused. Okay, the same thing for medical history in general, not this one only. They ask 2 questions together. Are you generally fit and well? Do you have any diabetes and hypertension? Why are you lengthening it like this? Usually medical history just ask an open-ended question. This is your chance to have an open-ended question. Can you tell me about your general health? This is how you can ask her. I don't really want to lengthen this video for all of you, because if I go on to open-ended questions and at which points you can ask them, believe me, we will not finish before another 15 or 20 minutes. So I'll stop here, and this is what I want to talk about. I hope the candidate who requested this for me, now it's very clear and easy for them. Practice, practice, practice. Don't stutter in between. Ask the question, patient answers. Ask the question right away. Please don't pause or have that or in between. All right, and simplify your questions. Just really quickly say them. Write them down if you have a problem. You can put them in cards like these and then practice them. With practice and repetition, you will definitely, believe me, you will memorize them. All right, so if anyone has any questions, you can just write them down in the comments below, or any special requests, those who could not reach me on Telegram or they're not in my Telegram group, and all the links for the website for any free sessions, recordings I do, recorded leaflets, Facebook group in which I have some videos as well, our Telegram group as well. If you want to join, all the links are found below. If you have any questions, you can reach me through any of these social medias. Okay, everyone, bye bye, and I hope all of you have a lovely night because it's night time. All right, bye bye.